So there are inflammation in the asthma. There is first acute inflammation, then there is chronic inflammation, which leads to structural changes. Fine. Inflammation, there is acute inflammation which leads to chronic inflammation, and there are structural changes over a period of time. Now what are the triggers, okay, of asthma? So the triggers are here. There are pets, okay, then exercise, then pollen, then bugs in the home, chemical fumes, cold air, fungal spores, dust, smoke, strong odors, pollution, anger, stress, pets. Fine. So there are number of triggers which can lead to asthma. So you see a man, he's doing exercise, then there are pollens, we all have bugs in the home, there are chemical fumes, cold air in winter, fungal spores, dust, strong odors, air pollution, stress. Drugs, there are three main drugs. In the small lower part of the slide you can see the names. There are NSAIDs, aspirin and beta blockers which lead to asthma triggers. Now how do you make a diagnosis of asthma? So first you have to take a good clinical history and examination. So you have to ask for the classical features which are persistent cough, wheezing and dyspnea. Atypical varieties of asthma are the cough variant asthma, nocturnal asthma, activity-induced asthma, persistent cough after an attack of URTI, recurrent pneumonia at different sites or same site. Now what investigations you have to do? Now the routine blood counts may not help. Okay, they may help or they may not help. If you go for a peripheral smear, then as we have previously discussed in the modern view of asthma slide, that the main pathophysiology is an allergen will trigger which two types of cells? The dendritic cells, the macrophages and the mast cells. The mast cells will degranulate and will in turn activate eosinophils. So now eosinophilia. Okay, eosinophilia is seen in the peripheral smear of asthma patients. You should always go for an X-ray chest to rule out TB. Now, these terms you must have heard in your pathology classes in the previous years: Charcot-Leyden crystals and Kirkman spiral. Okay, so if you go for a sputum examination, you will see for eosinophils, you will see Kirkman spiral bodies which are shown here. See, spiral, they are spiral in shape, they are from the shed epithelium. And Charcot-Leyden crystals, they are crystalloids containing gelectin 10, eosinophil lyophospholipase binding protein. Now what is the gold standard? But the gold standard is pulmonary function test. Always remember this: spirometry and peak expiratory flow rate. Fine. Now spirometry. Spirometry is useful in children above 6 years of age. It is an objective measure of airflow limitation. You have to measure FEV1, forced expiratory volume, in 1 second. FEV1 FEC ratio, it is less than 0.8. Then you have to check for the bronchodilator response. There is an improvement in FEV1 ratio, FEV1 by 12% or 200 ml if you give an inhaled beta-2 agonist to an asthmatic patient. Then you have to go for an exercise challenge. There is a worsening of these parameters, that is the FEV1 will worsen by 15%. Then you have to go for daily peak flow or FEV1 monitoring on day-to-day basis. AM to PM variation will be more than 20%. Now this is a picture showing peak flow measurement, that is PEFR monitoring. It is a simple, inexpensive home use tool to measure air flow and can be helpful in number of circumstances. See the picture. This is the graph, a nomogram.